I have seen a case where I was in school at that time,
Yes,
and
sir.
there was one small guy selling something in a small cart outside, and he went into fit suddenly. One person came and gave him the there was a tailor, and he gave
Yes.
him the
The iron things to
no,
hold.
scissors. Which
Scissors.
one? And he hit him like this. So he kept in his hand, and he directly
It
with
in
the
his
scissors he
eyes or
hit himself.
face. No.
So it should not be done, but we want to hear from
Sir,
the
here
expert.
again, seizures, we call them as seizures. Sir. A person who is suffering long term with seizures, they are called epileptic. Okay, epileptic. So the word is epilepsy, what you said is right. And the actual movements, the rhythmic movements of the body are called seizures. Okay, so I'll tell you one thing, please remember, seizures cannot be stopped without medication. Ongoing seizures cannot be stopped without medication unless and until they stop on their own. Okay. Usually any seizure episode comes about 2 to 3 minutes up to 5 minutes. It will stop by its own. Okay, it's just nothing but abnormal brain waves which are asking your body to move rhythmically, and the patient becomes unconscious. He doesn't know anything. Sometimes he bites his teeth, he uprolls his eyes. Sometimes only hand will move, sometimes whole body, both the hands, and sometimes one hand will move and then again going back to the whole body. So it's called focal going on to general tonic-clonic seizures. So when they stop on their own, people think that because I put something in his hand, it stopped. Exactly, what you said was right. Putting something, sharp things in the hand with the rhythmic movements, they harm themselves. And don't try to hold them hard, because we have seen shoulder dislocations, fractures when you try to hold the movements. So when you try to forcefully stop the movements, they undergo fractures. They go and falling down from a standing position can cause shoulder injuries, shoulder dislocation, shoulder fractures. We have seen many cases who come with shoulder fractures, and then they bite their tongue and they try to stop the mouth to prevent the tongue with them, but their fingers get cut because of the strength. Okay, it's all muscle contracting so hard that whatever comes in way will be bitten. Okay, so if you try to put something hard in the mouth also, the patient's teeth will get damaged, tongue will get damaged, he can get aspirated because of that. Okay, so what can be done in this situation? So what can be done is we call it as recovery position. Recovery position is nothing but make the patient lie down flat on the floor or any flat surface, turn him to one particular side. The best is to turn onto the left side, because the stomach is on the left side, the curve is on the left side. So when you do this, the stomach also goes down, it prevents aspiration. If this is not possible, on the right side is still okay, but when you do that, whatever comes out will come to the side and fall on the ground, preventing him to aspirate. Okay, preventing him. So that is a major risk. Any seizures, lack of oxygen and aspirating fluids are the major things which give the damage. Okay. So it's like, if you can't prevent aspiration, that means even if the brain is working, your lungs will not work.
Yeah, what you mean by lack of oxygen is due to
Because of the seizures, if it goes on longer time, so sometimes breathing is affected and the oxygen may not go to the brain. So as I told, it is usually self-limiting. Within 3 to 5 minutes, the seizures calm down. But if you don't give medicine within this time, so it can reoccur again and again. Sometimes it comes without any stop, without complete recovery. It comes. That we call it as status epilepticus. That means it's a status. That means the brain is, the waves are not stopping. We have to stop them by giving medication. So most of the times in the hospitals, in the emergencies, they put an IV in your veins, and then they give medicine through the vein. Sometimes when it is not found, when it is the still movements, they can give through the muzzle, in the prick and muzzle and give. They can have a sprays, nasal sprays. They can put sprays in the nose so that the medicine is gone into the body, and then it stops. So we have seen every kind of seizure patient. I have seen every kind of seizure patient. They respond to one medicines. But it is very important, as you told, don't hold them down. Don't put anything in their hands. Don't try to stop biting his tongue, and don't try to force open do things. Just put him in the lateral position, preferably left lateral position, and then whatever the position, which side is there, that hand should go straight under the head like this. The other leg should come to the body like this. This is called the recovery position. This leg should be straight and this leg should bend. That will prevent from falling back. Okay, so that is how you should do. That's called recovery position. So any unconscious patient, any semi-conscious patient, any fits patient who is having seizures or fits should be in this particular position to prevent aspiration.
Yeah, thank you, sir.